The liver is the body's main organ for processing food and waste materials, so, give an attention to your liver and complete this video to understand well. A healthy liver contains very little or no fat. If you drink too much alcohol, or eat too much food, your body deals with this excess by turning some of the calories into fat. This fat is then stored in liver cells. When fat makes up more than 5% to 10% of the total weight of your liver, you have fatty liver. Non-alcoholic fatty liver disease is a liver problem that affects people who drink little to no alcohol. Non-alcoholic fatty liver disease is becoming more common around the world, especially in Middle Eastern and Western nations as the number of people with obesity rises. It is the most common form of chronic liver disease, affecting about 25% of the world's population. In the United States, about 100 million people have non-alcoholic fatty liver disease. Some people with non-alcoholic fatty liver disease can get non-alcoholic steatohepatitis. It is a serious form of fatty liver disease that causes the liver to swell and become damaged due to the fat deposits in the liver. Non-alcoholic steatohepatitis may get worse and may lead to serious liver scarring, called cirrhosis, and even liver cancer. Non-alcoholic fatty liver disease often has no symptoms. When it does, they may include fatigue, not feeling well or malaise, pain or discomfort in the upper right belly area, itchy skin, abdominal swelling, also called ascites, shortness of breath, swelling of the legs, spider-like blood vessels just beneath the skin's surface, enlarged spleen, red palms, yellowing of the skin and eyes, or jaundice. These symptoms depend on the four main stages of non-alcoholic fatty liver disease. Most people will only ever develop the first stage. The main stages of non-alcoholic fatty liver disease are 1. Simple fatty liver, steatosis, a largely harmless buildup of fat in the liver cells that may only be diagnosed during tests carried out for another reason. 2. Non-alcoholic steatohepatitis, a more serious form of non-alcoholic fatty liver disease, where the liver has become inflamed. 3. Fibrosis, where persistent inflammation causes scar tissue around the liver and nearby blood vessels, but the liver is still able to function normally. If nothing is done to stop the scarring, causes cirrhosis. 4. Cirrhosis, the most severe stage, occurring after years of inflammation, where the liver shrinks and becomes scarred and lumpy. This damage is permanent and can lead to liver failure, where your liver stops working properly, and liver cancer. Severe liver scarring or cirrhosis is the main complication of non-alcoholic fatty liver disease and non-alcoholic steatohepatitis. Cirrhosis happens because of liver injury, such as the damage caused by inflammation in non-alcoholic steatohepatitis. As the liver tries to stop inflammation, it creates areas of scarring, also called fibrosis. With ongoing inflammation, fibrosis spreads and takes up more liver tissue. If nothing is done to stop the scarring, cirrhosis can lead to fluid buildup in the stomach area, which called ascites. Swollen veins in the esophagus, or esophageal varices, which can rupture and bleed. Confusion, sleepiness and slurred speech, also called hepatic encephalopathy. Overactive spleen, or hypersplenism, which can cause too few blood platelets. Liver cancer. End-stage liver failure, which means the liver has stopped working. Possible causes of non-alcoholic fatty liver. Genetics or family history of fatty liver disease. Being obese or overweight, especially around the abdomen, when fat is centered in the waist. Having high blood cholesterol or high triglycerides. Having type 2 diabetes mellitus or insulin resistance, which happens when your cells don't take up sugar in response to the hormone insulin. Growth hormone deficiency, which means the body doesn't make enough hormones to grow. Metabolic syndrome. Obstructive sleep apnea. Underactive thyroid, also called hypothyroidism. Underactive pituitary gland or hypopituitarism. Certain medicines. Having polycystic ovary syndrome. These combined health problems may contribute to a fatty liver. However, some people get non-alcoholic fatty liver disease even if they do not have any risk factors. Please, like and subscribe to get this valuable health information. See the next video for prevention and treatment of non-alcoholic fatty liver. Thank you for watching.